Are there some factors that make people more susceptible to be misdiagnosed? Where is the gap in that, that's creating that window where we miss some of those opportunities?
I think there's certainly multiple layers. There are certain rare types of thyroid cancer that sometimes, for example, the most aggressive form of thyroid cancer, it's called anaplastic thyroid cancer. And pathology-wise, it can look like a very heterogeneous tumor, and sometimes it can be mistaken by a sort of intermediate risk thyroid cancer, which would be like poorly differentiated thyroid cancer. So there's that part on the access to pathology expertise. Certainly, misdiagnosis, for example, thinking about anaplastic thyroid cancer. These patients sometimes can present with a rapidly growing neck mass that may present as hoarseness or neck pain, and many times they go to a community physician and primary care and they get treatment with steroids or ibuprofen, and it's not until the disease starts becoming more advanced that somebody gets more imaging and then finds the disease. So there's multiple layers where these things can happen, and so certainly more and more ensuring that patients have thorough imaging if they're being surveilled for a thyroid nodule, not only looking at the thyroid but also looking at the whole neck. And whenever a biopsy is performed, if the results are inconclusive, certainly considering molecular testing, second opinion pathology consultations, and expert consultations at specialized centers.
That sounds great. Thank you so much for joining us. Do you have anything else that you'd like to leave us with? Any kind of last comments to your colleagues in the healthcare field?
Well, first of all, thank you so much for the opportunity. I would say several messages. I think the first one and the foremost is that there's no good cancer, and thyroid cancer is not the good cancer. We should not underestimate, as lower risk patients can have still significant impacts in their quality of life and even financial toxicity from being diagnosed with thyroid cancer. They have been shown to have higher bankruptcy rates. So it's very important that we never minimize the journey that our patients are going through. And then for the more advanced thyroid cancers, whether medullary, anaplastic thyroid cancer, or radioactive iodine refractory thyroid cancers, many of our patients that are on systemic therapy, physically, they may not necessarily show signs that they're on treatment, but the struggle and the side effects that they're going through is still very valuable. So we're currently working on a protocol to see the effects of these treatments in their quality of life. And so for our colleagues in the community, when you identify these patients, as I said, certainly considering clinical trials and multidisciplinary expert teams so that we can hopefully one day continue moving forward the needle from the ray of hope that we have been able to see for these patients in advanced thyroid cancer to being able to actually provide them with a cure. Thank you so much for the opportunity.
Thank you so much for joining us.